Hi, this is David Kettlewell, and welcome to Medical Matters, because life matters. Haven't all of us wondered, what is psychotherapy? How do you know if you need it? Is it real? All this and more in just a moment. Talking about psychotherapy, and let's go ahead and meet our guest today. We have Dr. Susan R. Davis, PhD, and we're going to be talking today about psychotherapy. First question, why do people have trouble seeing anything having to do with psychology as in the real world?
I think because people want to believe that things that you can touch and feel are safer than things that just go on in your head. So when somebody is having some sort of a depressive episode or emotional problem of some kind or another, it's really easy for them to say, okay, that's not something that really is something I need to deal with. Nobody else can see it. I can keep it to myself. And so that's not really real. If I have a wound on my leg or I'm sniffling, then we know that's a real thing because other people can see it. And then I feel okay letting others come and take care of me. But with internal pains, I think we tend to pretend those things aren't really happening.
There are many times in our show when we've touched on the following concept. We were talking just yesterday with someone who works with people who have had horrible accidents and they're in the hospital, maybe have lived there 5-10 years in a nursing home even, trying to get out into the real world. And for them to think life could be better is this big leap. Why is what we think important?
Well, you know, the difference between mind and body is one of those things that I think as time's gone on, we've begun to see there's not a whole lot of difference between the two of them. So what we think does, in fact, affect our health and our physical health, as well as our physical health affecting what we think and feel.
Do you have an example?
Yeah. For example, someone who has suffered a heart attack recently. We know that individuals with cardiac problems often have serious problems with depression following their cardiac events. And if you treat the depression, then you also have a much better outcome from the actual recovery from the heart attack.
A lot of people may not be able to define what a psychologist is and what is the difference between a psychologist and a psychiatrist. Let's cover that ground.
A psychiatrist is a medical doctor who is typically board certified in psychiatry. Psychiatrists will often evaluate for medical management as well as perhaps provide talking therapy. Psychologists have a doctorate, meaning that they have obtained a PhD in psychology. So typically clinical psychologists, which are the psychologists that do treating of mental illness, and I shouldn't limit it to clinical psychologists, they're counseling psychologists, some school psychologists, but typically those three groups must be licensed, and once they've passed licensure, then they focus mostly on talking therapies, on psychotherapy. They don't prescribe medication. They typically work with psychiatrists who do prescribe medication, and so sometimes you'll have both things going, a physician who will do the medication management and a psychologist who will do the actual psychotherapy. Okay, and again, a psychiatrist is oftentimes an MD. Correct. Or has a PhD, you said? No, a psychiatrist only has an MD. Only an MD. And a psychologist only a PhD. A PhD. Okay. Mood. Gee, it's not like when you're driving on a road and it says Niagara Falls is this way, and you know that exit will take you there. You might have a mood and you say to yourself, well, I feel really poorly or a little depressed, or I'm not thinking very positively, and I think people have all experienced different levels of personal depression. There's been times when things just feel dark and times when they feel very light and life appears with no problems. But how do you determine that what you're thinking, what you're feeling, will be best coped with
by seeking the help of a professional psychologist?
Well, it's a good question with a pretty ambiguous answer, I think. The best answer is if you feel as though you are not improving and you don't know where else to turn, one place to go is to look for a psychotherapist. Lots of times other people will notice and tell you something. And so you may be thinking, yeah, maybe I'm a little down or maybe I'm a little anxious, but I'm actually doing okay. And the people around you will say, you know, we've noticed that you're sleeping late, you're not sleeping at all, you seem irritable, we're worried about you. So that's another way people know. Sometimes as part of an annual physical, your physician will say to you, gee, you know, some of the things that you're talking about suggest to me you might want to seek the help of a psychologist, a psychiatrist, social worker, something along those lines. So you can get it from the outside. If you're feeling down and you just can't seem to get yourself up and out of it, those are times when you might want to consider contacting someone for some additional help.
What do you think are the kinds of stigma or concerns about stigma that people have prior to contacting a psychologist?
It's gotten much better. I think that some of the old stigma that one had to be crazy, that one had to be hearing voices or seeing things that weren't there, some of the indicators of very severe psychiatric disorders, that those sorts of things had to be in place in order for you to benefit from seeing a psychologist or a psychiatrist. And I think the embarrassment that goes with talking to somebody about emotional issues has also reduced, so that, you know, in many cities, the hip thing is to see a therapist. Whether or not that's the case, I think many people still have some degree of embarrassment with the idea being, these are things I ought to be able to do myself. I shouldn't need any help for. As if somehow the therapist is actually going to solve the problem, which of course we don't. What we do is help an individual solve their own problems. But I think the stigma attached to it is really reduced over time.
We have all had a situation where somebody has exhibited a behavior or said something that makes us stand back and say, gee, maybe they need some help. As an example, I remember a situation where a woman said to me that she had tried to kill herself by taking a knife and slitting her wrists by the kitchen sink. Well, there were no slices on her arms, I could see that, but I think what she meant to say was she had been thinking about doing that. It was someone in school, and I went to the head of the school and said, I think this individual might need to see a therapist. And the head of the school said no. And I said, well, they said they tried to kill themselves. Well, no. I've talked with people about that, and I guess my question is, if somebody says they're going to kill themselves or they're thinking about killing themselves, should you do something?
Absolutely. Sometimes we have this idea that somebody who's saying things like that may be saying that in order to gain attention, and that will be the reason for minimizing it. And you know, my own thought is, if someone has to resort to saying, I want to kill myself in order to get attention, then perhaps they need attention. So that's the worst case scenario. If someone is telling you that they are thinking of suicide or actually have attempted suicide, you take that very, very seriously.
For more Medical Matters television shows, go online to medicalmatters.tv.